Welcome to my channel. When you are recovered with COVID-19 and you often ask many questions and concerns that come up, here, we are going to see the steps and the precautions to be followed after recovery from COVID. The COVID-19 pandemic has created a global health crisis with the number of deaths and steady rise in the new cases increasing daily throughout the globe. Normally, a COVID-19 patient with mild symptoms usually takes around 2 weeks, while a seriously infected case takes about a month to recover. Following a good health regime, nutritious diet, exercise, stress-relieving measures, and yoga often help in early recovery. A good immune system is vital for the prevention, to safeguard from disease progression. COVID-19 affects multiple organs and body systems, including the heart, blood vessels, lungs, kidneys, skin, brain, and nerves. Some of the signs and symptoms of lingering COVID conditions are continuous shortness of breath, chest pain, breathing trouble, the reappearance of fever, severe fatigue, painful joints or muscles, and dizziness while standing. There are cases that have been reported, where patients had the novel coronavirus again. Here are the post-COVID care steps suggested for an individual by doctors. Have a balanced, nutritious diet. Those who have recently recovered from the coronavirus need more energy, proteins, vitamins, and minerals to regain stamina and energy. Experts suggest that one's diet should include foods that boost immunity, preferably easy to digest, freshly cooked soft diet. Make sure your diet includes plenty of proteins, legumes, seeds, nuts, boiled eggs, fruits, and probiotics. Avoid fast food, sugary beverages, and carbonated drinks. Drink plenty amount of water to stay hydrated. Self-health monitoring at home. While at home, it is important to monitor the condition of patients like body temperature, blood pressure, blood sugar regularly at least once a day for any signs, symptoms, and complications. Continue to monitor your blood oxygen saturation level with your pulse oximeter. Even if you have recovered from COVID, there could be lung damage that you might not be aware of. If so, your oxygen level will fluctuate and fall below 90. You will need to consult your doctor right away. Look for early warning signs like high-grade fever, breathlessness, oxygen saturation level below 95, unexplained chest pain, new onset of confusion, and focal weakness. Exercises. All patients after getting cured of COVID-19 must continue with breathing exercises, daily practice of yogasana, pranayama and meditation, as much as health permits or is prescribed. Asymptomatic patients can resume their workout sessions after 7 to 10 days. Patients with comorbid conditions such as hypertension, diabetes, cardiovascular diseases, or renal failure should wait for 3 to 4 weeks before they start exercising. The best exercise is to start with jogging or walking for 5 to 10 minutes and then double the timing slowly. One should stop exercising if they start feeling breathless and should not overexert. Tests you must take. People with comorbidities like hypertension, diabetes, cardiovascular diseases, or renal failure should consult the doctor and perform some tests to see whether COVID-19 has had any impact on organs like the heart, kidney, liver. Patients who have been infected by COVID-19 should get vaccinated 3 months after the recovery. Diabetes care. Special care should be taken for patients who are diabetic because while on the treatment they would have been subjected to steroids, which tends to escalate the sugar levels. It's usually observed after recovery such patients go back to their normal diets and they can end up in hospitals again because of high sugar levels. Always be in touch with your doctor if you are suffering from comorbidities. Get adequate 8 hours sleep and rest. Proper sleeping times should be maintained. An average of 6 to 8 hours of minimum sleep is needed. When you sleep, your body speeds up the recovery procedure. During sleep, the immune system releases certain cytokines which remove toxins and physical stress from our body and increase our immunity. Loss of smell and taste. Most COVID-19 sufferers who lose the ability to taste or smell recover within 3 or 4 weeks. A recent study found that 10 to 15% recovering from COVID-19 still lose the senses up to 5 months. Experts say having COVID-19 can cause inflammation that damages key nerves. It can even affect a part of the brain that deals with the senses. People who have upper respiratory problems or allergies may take longer days to regain the smell. Cough will persist for 2 to 3 months. Cough is one of the signs during and post-COVID. To stop dry cough with itching instantly, melt a pinch of turmeric powder or dry ginger powder in the tongue or 1 to 2 pinch of licorice powder with honey in the tongue to avoid dry cough and irritation. For chesty cough, steam inhalation is effective to loosen the mucus. Inhaling steam by adding 1 teaspoon turmeric powder in water is a great way to get rid of a chesty cough. Also, health experts recommend saline gargles with turmeric and salt for sore throat and cough. Insomnia. Patients recovering from COVID-19 reported difficulty in sleeping. Some of the causes include anxiety, mental stress or loneliness triggered due to staying in isolation for weeks or being hospitalized for critical conditions. Exercise and a balanced, healthy, nutritious diet help your mind and body to stay healthy and fit. Do yoga and meditation to calm your body and mind. Hair loss. Some people may experience hair loss after being sick with COVID-19. The type of hair loss is associated with COVID-19 is called telogen effluvium. Doctors believe that due to the physical and emotional stress that accompanies a case of COVID-19 can lead to a reversible hair loss condition. This can be controlled by taking vitamin B complex, biotin supplements, fruits and vegetables, getting plenty of rest, and staying hydrated. After having recovered from a coronavirus infection, it is important to follow a healthy lifestyle and focus on alarming signals. Follow instructions from your doctor and healthcare department, including following general steps of staying hydrated and drinking plenty of fluids, practicing breathing exercises and meditation, following a nutritious diet, getting adequate sleep, avoiding smoking and alcohol will always keep yourself fit. COVID care is essential and should not be ignored. This is important for your future health. Taking precautions, such as physical distancing, wearing a mask, keeping rooms well ventilated, wash hands regularly, avoiding crowds, and coughing into a bent elbow or tissue will help in protecting you and others from COVID recurring. Thanks for watching. Stay safe.